A tic is your body reacting, and a compulsion is your brain looking for safety. If we first were to look at a tic, that is a sudden involuntary movement. This can be a motor or vocal tic that is completed, usually brought on by an urge. And we could sometimes delay it, but often it's coming out as this involuntary movement. Whereas we look at a compulsion is an intentional behavior completed in order to remove distress from a feared outcome. And here's the question. Well, how do we treat tics? And what do we do if you're experiencing both tics and compulsions? So firstly, in treating tics, we offer a treatment known as comprehensive behavioral intervention for tics. We then create what are called competing responses. Competing responses are behaviors that help block the tic from being able to occur, and they are meant to be more subtle than the tic itself. A competing response is something where we're kind of utilizing and flexing our muscles in a way that we physically cannot engage in the tic. So for example, if we had, say, an arm tic where your arm was moving involuntarily up, we would be looking at trying to flex the muscles that ensure the arm is down. So looking at utilizing your lat muscles, keeping your elbow close to your side, and holding this position for enough time that the urge then subsides. You would then release, and if you felt this urge come in again, you would engage in that competing response again. Competing responses are so individualized by the person, and this is something that you walk through more in treatment to learn what works for you and helps you with the tic. Another thing with tics is the more you wish them away, the more they are going to be present. So we really want to encourage a tic-friendly environment where we're saying, yep, bring on the tic, I can handle it. If you have someone in your classroom as a teacher or a parent at the dinner table, we don't want to put pressure on saying no tics and cause any repercussions for having a tic. Instead, we want to be like, yep, bring on the tic, we got this. And the more we just embrace the tic, the less pressure to remove it, the less stress there is. So when it comes to OCD and tics and they're presenting together, where do we go from there? What do we treat? We look at what is the most presenting concern. If the tics are quite present, we may look at some of those competing responses to help reduce the pain and help you go through your day-to-day life with some tools. And what we notice is when you engage in treatment for the OCD, you're reducing your stress significantly and you're building tolerance to distress and anxiety. With this tolerance, you will likely see a decrease in the tics because tics thrive off of stress and anxiety and in fact will increase. So in treating the OCD, we're going to see some decrease, and we're also sprinkling in those competing responses and really building that understanding and awareness to the tics that you're experiencing. OCD and tics don't need to take over your life. So come visit us here at OCD Wellness.